Okay, so I am back with the care planning section, which majority of the students have a really hard time with this area, and this is one of my um, areas that I love to teach and hopefully help make it a little bit more clear and help you understand it a little bit better. So for continuing with our same patient that we have, they have a medical diagnosis of myocardial infarction. And one of the things that I encourage you to do is to kind of take a look at the whole picture of the patient. So the patient had a history of hypertension, they had cholesterol, they had, not sure, diabetes, but the two diagnoses that I had listed were MI and DVT. So when you do your care plan, you need to look at the whole picture of your patient, not just the diagnosis that's listed for each patient. So here you can save your care plans and use them again later and just modify them, which is also kind of nice. But for right now, I'm going to do a new care plan for this patient. And here it gives you the option to add the medical diagnosis, and then automatically nursing diagnoses will pop up for you. This completely takes away the thinking aspect of it. So, not that you don't have to think about it, but back then we used to have to actually look for nursing diagnoses that applied to this medical diagnosis. One thing to make note of is that you are not allowed to use a medical diagnosis for your nursing diagnosis. So the way that we use this in nursing is that we change it. So for my number one, my most priority, most important nursing diagnosis is going to be decreased cardiac output. And that is going to be my number one nursing diagnosis. Now, this is an actual diagnosis, it's not a potential, and we will get to that. To make it easy, I just say expand all so you can see everything. This pops up with related to sections that come up for you that are pre-populated, and I'm going to just say, we'll say alteration and afterload. You can also add your own, and I'm going to type, let's see here. We'll say changes to heart rhythm. I'm going to add that, which is kind of about the same thing. We could do altered heart rhythm here, but just as an example to add. Now your as evidence by is going to be something that you can physically see, you can measure, you can, the patient reported to you. Now, if you have alterations in afterload or contractility, then you're going to see physical signs and symptoms on the patient, such as shortness of breath, a fib, a flutter, lower extremity edema, things like that. So for this one, I'm just going to put altered heart rate and rhythm because the patient, if you remember, was sinus tachycardic. And then we're going to say anxiety and restlessness. Now, if the patient told you something, you can also do things like, troponin elevated or specific lab values. And that's going to justify your as evidenced by should justify your nursing diagnosis and your related to. The related to is basically just what is causing this, what is causing the nursing diagnosis. Okay, and then the as evidenced by justifies that. Your expected outcome, this pops up for you, so it comes up with certain things. So not all of them are going to apply. So it's important that you read through them and you make sure that it is pertinent to this nursing diagnosis and it's pertinent to this patient. For example, if this patient didn't have any issues with peripheral pulses, their peripheral pulses were already strong, then I'm not going to put that because it doesn't really apply to my patient. What does apply is patient will demonstrate adequate cardiac output as evidenced by an ability to tolerate activity without symptoms of dyspnea, syncope, or chest pain. And you should have a minimum of 3 to 5 of these expected outcomes, okay? A patient will explain actions and precautions to take for primary and secondary prevention. And over here, this pops up because you're supposed to type in a measurable and timed goal. So SMART goals is something that you need to look into and make them very patient specific. So it needs to be measured, it needs to be attainable. The patient needs to have a realistic time frame for them to be able to achieve these goals. So if the patient is not ever going to be able to tolerate activity without signs and symptoms of dyspnea, then you need to make it something that's realistic for them. So patient will ambulate 5 feet, and making this specific is going to be patient will ambulate 5 feet while maintaining an O2 sat above 93% on 2 liters. So your measurement is your 5 feet and then O2 sat of 93%, maintaining an O2 sat above 93%. And your time frame is going to be however long you want this goal to be achieved. So on your shift may not be realistic for that patient. So I personally feel like it's okay to do before discharge. However, you're not always going to be with that patient throughout their entire admission. So you should include something that's measurable and timed on your shift, and then you also want to include something that's a little bit more longer term. So we'll say by day of discharge. Some people want you to add a little bit more detail, but for that, I think you get that point. Now, patient will explain actions and precautions to take for primary and secondary prevention of cardiac disease. This is kind of vague, so a measurable and timed goal is something more specific. So patient will verbalize 3 lifestyle modifications to include into diet/activity routine, to use at home, and they're going to verbalize it prior to discharge. And then remain free of side effects from medications. So this is more short term while on your shift. So patient will maintain heart rate of 60 to 90 throughout duration of 12-hour shift. So 60 to 90 is my measured, and then my time frame is my 12-hour shift. Okay, so hopefully that makes sense. And for your interventions, these are things that we are doing. So interventions, something that we're doing that is contributing to our nursing diagnosis. So we don't want to be giving tons of IV fluids and putting the patient into fluid overload. We want to be able to give them oxygen if they're short of breath. We can assess and monitor for signs of depression, assess pulse ox readings regularly, and assess for chest pain, side effects of medications. And if I'm not mistaken, I believe you need to have, oops, that did not, well, that didn't work out very well. It logged me out of everything. But I'm pretty sure that you have to have at least 6 interventions. So, and your rationales are just as important. So what would be the rationale for cautiously giving IV fluids? Well, we don't want to put them into fluid overload and cause increased work of the heart. And then maintain O2 sat greater than 95% to promote oxygenation. I'm just going very vague here, but I think you get the point. Signs and symptoms, increased depression, can worsen compliance with lifestyle modifications. And then pulse oximetry, we want to assess because we want the patient to maintain adequate levels of oxygen to perfuse the heart, etc. Chest pain can indicate assessing. We want to be able to maintain an adequate comfort level. So this can indicate exacerbation of illness. I think you get the point there. So I'm going to save it. I did do a rationale. Oh, okay. So it wants me to include a rationale for each intervention, which I thought I did that, but apparently not. Okay, so I guess it didn't save any of those. Not sure why. So now I'm going to go back and fix it all. I'm not sure. You can add your own here and hit add. Oh, see, there it is. So I had a few that were blank, so that's why it's not letting me save it. As you can see, there are several options to pick from. So just pick the ones that are most important. Okay, now my second diagnosis is going to be, I'm going to do fluid volume excess. So let's do myocardial infarction again. And fluid volume, is that on here? Nope, I don't want to add that one. Oh, so it only popped these up for me. So, you need 6, so we can pick one of these. Actual problem. And related to let's see here. We'll say deficient knowledge of disease process as evidenced by, we'll say edema, blood pressure changes, skin characteristics, pale skin, expected outcome. Patient will, measurement, will demonstrate adequate tissue perfusion. Let's see, what could we put? We'll have, let's say edema will improve from 2+ to 1+ edema after elevation of lower extremities by end of shift. Patient will verbalize 2 indications for preventing clots in lower extremities. I think you get it. But either way, I'm just going to add that there. Okay, so the priorities are important because this is what is targeting what we're doing for our patients. So this is going to be my number 1, that's going to be my number 2. Actually, this is my number 1, I'm sorry. My decreased cardiac output is my most important thing that I'm trying to do. And then based on my orders, if a doctor had like elevate extremities, wear SCDs, promote ambulation, then I'm going to be using this as my number 2. And then just to make it so that you can understand the risk for diagnoses, I'm going to add a third one, and then that is it. So I think you get it. So risk for, we're going to say risk for bleeding because the patient is on a blood thinner anticoagulant. And this is a potential problem, so it's not an actual problem yet, but we're trying to prevent that from happening. So you can put the medical diagnosis here, but you don't have to. We can say deep. Now, bear with me, it's kind of hard when I don't have my other screen up here. Deep vein thrombosis. It just popped that up because I had started over here. So now I hit DVT here, and then here it pops up here for me. But I'm going to put risk for bleeding. and I added that there. And it's a potential. You don't have to do related to in risk for because it's not an actual problem. Now if I changed it to actual, then it should let me type it in. And then, oh, I might have that wrong actually, sorry. If it is an actual problem, which DVT is, but risk for bleeding is not yet, but we want to make it a real problem. So related to use of anticoagulation medication. Sorry, it's been a long day. Anticoagulation medication, you can see warfarin. To be more specific, I like details, and I typed that in. So the reason why there was nothing here is because I added this myself. So that's why there's nothing there for me. And there's not really going to be any evidence that you can justify with risk for, but you can always add things like patient or orders to monitor PT-INR. Patient has bruising. Obviously, you want a little more detail. And then, so this isn't going to pop up things for you like the other sections did. So my interventions are going to be, sorry, let me click here. As evidenced by my expected outcome, patient will not demonstrate, or patient will remain at therapeutic levels of anticoagulation, INR between 2 to 3, and so INR 2 to 3 every 8 hours, and save. Okay, so now I'm going to make this my number 3. Okay, so hopefully that makes a little bit of sense. And just to kind of close out this section, I'm going to go into patient teaching here. And patient teaching is extremely important because you want to give yourself credit for your teachings that we do with patients. We don't realize how much we do. So let's go here. We're going to add immobility management. Nah, we won't add that. That one's kind of not pertinent to this. Let's see here. Tissue perfusion management. DVT care. We're going to talk about medications here. I think we got to add this. We're going to do prevention, SCDs, facts. We're going to talk about TED hose, stockings at home. We educated the patient and their spouse. We verbalized discussion. We gave them handouts, maybe showed them a video. There's no barriers to learning. And then the patient verbalized understanding, or if they need more education, then we needs practice or unable to return demonstration. So you should have some sort of teaching, and as nurses we do have to document education. So we can do diagnosis, it pops up, MI, risk factors, add, possible complications. We can do signs and symptoms here. There are so many different types of things that you can add here. So I think you get the point. It kind of just breaks everything down for you. It's very interesting. It makes it easy for you. You don't have to do a lot of extra stuff, but mostly I wanted to show you that it breaks everything down here for you. Now, if the patient had surgery, then it would pop up what surgery they had and what type of education. Oops. We'll say they had an ablation, pre-procedure teaching, explanation, add. So I think you get it. Again, if you have any questions or concerns or you're just overwhelmed, I know it's a lot of information, but I just like to show you all of that stuff that we went over. Now, to kind of close everything up, I want to show you the summary. Save changes, yes. Okay, I get it. Review. I educated them on all these things. Now I'm going to go to my summary, just so you can see everything that we just did. It talks about my fall risks, my code status, basically everything we put in here, their medical diagnoses, nursing diagnoses, lines, drains, if they had any wounds. Now, I can come here and look and see if you did this, and it'll say no data entered. So if it wasn't documented, it wasn't done or addressed, obviously there's more areas that are more important that need to be included. So please make sure that you are including everything that is required. Okay. So for your reports, if you go here and you want to just see, I like to, let's see here. I'm trying to see where you need to go to submit your stuff here. Generate report. Sorry, we're kind of learning this together at this point because I'm not sure where it took me. But I think you get the point. I'm trying to just finish everything so that you can see where to go to submit everything. And if I'm not mistaken, it shows a different tab down here. It'll say generate, and then you have to click on everything that you want generated. It'll pop up with a big generation, like a generated report, and it has everything listed here. So this is what I was trying to get to, and this is what gets submitted to us. Okay, so there's our Morse fault, and this is just a good check for you so that you can see everything that you did or if you forgot something. So everything that's here in blue, this is a good way to check yourself when you're over here on this screen. Obviously it's expired. But you can check this and make sure that you have all areas completed. Okay, so that is our care plan SimChart submission. I did one from start to finish with you guys. Obviously, you will have a little bit more detail because you'll have access to the full medical record. I kind of just made all of this stuff up and pulled it out of my head. So if you have any questions, let us know. But hopefully that was helpful and you can see kind of everything that's expected of you. I know it's a lot of information, but eventually, like I said, it'll get easier and will make more sense as you do it more. So I am going to sign off, hit generate HTML. And then it will submit it to my instructor or to me. So let me know if you guys have any questions, and thank you for being very patient with these very long videos. I couldn't make it any shorter, so I apologize if they were terribly boring, but thank you for being patient, and I hope everyone has a great semester.